in stroke, we say up to 80% of strokes can be prevented, which is huge, right? But how do you do that? You do that by identifying your own risk factors and changing them or modifying them appropriately. In order to try to prevent a stroke, the move that anybody can do is really talk to their doctor and go over what their personal risk factors are. So we know a lot of medical conditions increase someone's risk of stroke. Some of the non-modifiable risk factors, someone's age. If there's a very strong family history of stroke, race has a lot to do with stroke in terms of the type of stroke you might have and the prevalence of stroke. But we go after things that we can change. So we know that high blood pressure or hypertension is the #1 reason why people have heart disease and stroke. The biggest thing is to identify if you have blood pressure, treat it. You need to have a discussion with your doctor. What is the best way? Sometimes it's just diet, sometimes it's exercise, sometimes it's all those things plus medication. Also review other things that are associated with stroke, including diabetes, so that's when someone has very high sugar in the blood, elevated cholesterol, heart disease, smoking, obesity. So all those things we can do something about. So sometimes people can develop an underlying blood clotting abnormality they know nothing about. Clots develop in the body, go to the brain, and cause a stroke. So we need to look at their blood. Aspirin is very important in stroke prevention. Aspirin is what we call an antiplatelet medicine. If you cut yourself now, all these platelets have to sort of clump or come together in order to create the clot. Aspirin doesn't allow them to clump as effectively. It doesn't mean that you can't clot at all, but it means that your bleeding time probably is a little off. A secondary stroke prevention, meaning after someone's had a stroke, is many times we'll use aspirin to try to improve blood flow over their whole life. So they will take 1 aspirin a day. If you think of the arteries as pipes, they have to be open to allow enough blood flow to get to the brain. A carotid endarterectomy or vascular surgery would be appropriate sometimes to improve blood flow to the brain. So the important thing is to keep open the lines of communication. So we want people everywhere to be able to identify what their own personal risk factors are, because it's key in reducing the chance of stroke in the future.